You watched two jack dudes beat each other up in the grand finale of Roadhouse, and now you want some of that anabolic stamina for your next mixed martial arts match. I know nothing of fighting techniques or choking people out, but I do know performance-enhancing drugs and how to maximize strength, aggression, stamina, endurance, hand-eye coordination, and the recovery from traumatic brain injuries following repeated punches to the head. So stick around if you'd like to know more. Vigorous Steve here. By popular demand, here's the ultimate MMA performance-enhancing drug protocol that's anything but WADA or USADA approved. If you'd like me to make a specific WADA or USADA compliant stack, just let me know down below in the comment section. If the demand is there, then that video will be made. I recently made an entire video series on how to optimize endurance for athletes, and we'll be using the exact same performance-enhancing drugs to design a stack for mixed martial arts fighters. And this stack might as well work for Brazilian Jiu-Jitsu or Krav Maga or boxing or any other discipline that's included in MMA. Basically, it'll work for any kinds of contact sports, including rugby or sumo wrestling. Now, I won't go too in-depth for each compound individually because I included many of these compounds already in the Optimized Endurance Deep Dive video series. Just follow the links down below and use the timestamps to skip ahead to the compound that you're interested in. Some of these compounds already have dedicated videos on my YouTube channel, which are also linked down below. We'll split this video into 4 segments: how to improve strength and aggression, how to improve endurance and stamina, how to improve hand-eye coordination and overall reaction time, and how to improve recovery from traumatic brain injuries post-competition so you can get back on your feet ASAP, soldier. So let's get started with strength and aggression, as that's a huge part of MMA, especially if you're a grappler, because then you need to get in real close. Now, there are a lot of misconceptions in the fighting space about using anabolic androgenic steroids to improve strength and aggression. Don't get me wrong, steroids do have their place, but they're way overused by amateurs as well as professionals, and it's probably the sole reason why so many athletes nowadays in MMA tap out or gas out well before they should. I would advise any fighter out there to limit themselves to true hormone replacement therapy, where serum testosterone remains at the top of the reference range, but not super physiological, at least initially, right? You can always increase later on when your stamina and endurance improves on this performance-enhancing drug protocol. But at the start, if you're thinking about dabbling, don't go too ham, too crazy right off the start, because your body weight will increase, and an increase in body weight, especially abruptly, will surely hinder your endurance and stamina. So you could go with cookie-cutter hormone replacement therapy, testosterone, any ester, between 105 to 175 milligrams weekly, right? Whatever gives you top of the reference range serum testosterone levels. DHEA and pregnenolone, I would start at the low end at 25 milligrams daily, maybe increasing to 50 milligrams daily. And with pregnenolone, that will be between 10 to 25 milligrams daily. Again, the protocols are right on the screen. Human chorionic gonadotropin, 250 IUs to 500 IUs sub-Q 3 times weekly, Monday, Wednesday, Friday. Growth hormone, 1 to 2 IUs before activity or a sub-Q before bed. And dinyl-methane to kind of help balance out your serum estradiol levels. If testosterone is at the top of the reference range, DHEA sulfate is at the top of the reference range, pregnenolone levels top of the reference range, then I would advise you to keep serum estradiol at the top of the reference range as well. It's the testosterone and the estradiol that helps with protein synthesis, recovery, and overall anabolism, so you can recover from your matches and sparring sessions as soon as possible. And growth hormone before bed or before activity will help with that as well. But since growth hormone and HCG do potentiate a good amount of water retention, I would advise everybody to discontinue growth hormone, HCG, and thus dinyl-methane 3 weeks before a real competition, so you can get your body weight levels down, and then use a real aromatase inhibitor, aromasin, at let's say 6.25 milligrams orally, maybe 2 to 4 times weekly, to bring your serum estradiol levels from the top of the reference range to, let's say, the middle of the reference range, in order for you to have a very successful and easy weight cut, so you don't need to spend a week in the sauna spitting into buckets and doing all kinds of diuretic protocols. Simply because your estrogen is managed, you don't retain so much water and the weight will come off significantly easier. And then depending on your level of development, the overall weight increase that you got from cookie-cutter hormone replacement therapy, how that affects your stamina and endurance, your overall mitochondrial functioning, your recovery capability, how often you train, you could consider the following anabolic androgenic steroids alongside your cookie-cutter HRT protocol. You can look into boldenone and destinate, better known as equipoise, at the same dose of the testosterone that you're taking. You don't have to worry about the ester. It usually plays out in a 1-to-1 ratio where you don't need to use an aromatase inhibitor. So let's say you were using 105 milligrams testosterone enanthate or cypionate weekly. I would start by adding in 105 milligrams boldenone undesonate, right? A 1-to-1 ratio. Now you don't need diindolylmethane or aromasin to control your serum estradiol levels. It should still stay towards the top of the reference range because you're using human chorionic, gonadotropin, DHEA, and pregnenolone, which contributes to estrogen synthesis as well. But if you increase the boldenone dose a little bit later on, or remove the HCG, DHEA, and pregnenolone later on to make a weight cut, then your serum estradiol levels will still end up, let's say, middle of the reference range, favorable for weight cuts. Alongside of that, you could consider chlorodihydromethyltestosterone, better known as oral turinabol, at dosages between 5 to 10 milligrams orally or sublingually, pre-workout or sparring sessions, or split morning and evening on rest days. Keep in mind that oral turinabol might potentiate cramping, but since it inhibits aldosterone synthesis, it might also make weight cuts significantly easier because aldosterone levels are somewhat suppressed. Now, if you don't respond well to oral turinabol, I would consider oxandrolone as an alternative in similar dosages, 5 to 10 milligrams pre-workout or split AM PM on rest days. If you want to make a comparison, I would say that oxandrolone anavar is better for mind-muscle connection and overall strength. So if you're a grappler and you get guys on the floor and you want to choke them out, then I would say anavar is the way to go. But if you're a kicker and a puncher and you're running around the ring during multiple rounds, then I would go with oral turinabol, right? Try one of these separately during your off season where you're preparing for your upcoming match, and then see which of these oral steroids you prefer. Then, before the match, only 2 or 3 days leading into the contest, you could consider fluoxymistralone, halotestin, dosages between 2.5 to 10 milligrams orally or sublingually, or take a full dose, 5 milligrams to 20 milligrams sublingually, 1 hour before the match to increase aggression. Oral turinabol and anavar don't really improve aggression, but halotestin, man, it really, really, really makes you angry. Now, I'm sure you guys have heard about Trenbolone. Trenbolone will make you angry, but it kills your endurance, kills your stamina. I would not use Trenbolone if you're a fighter in any kind of discipline. Halotestin 2 or 3 days leading into the match, and then maybe on the day of the match. That is more than enough. I would not exceed 4 days. Ideally, you only do 3 or maybe 2 days, because the longer you take halotestin, the worse your endurance and stamina will be. Just keep in mind that while steroids are a great way to improve strength and aggression, they are a very poor option to improve endurance and stamina. Testosterone and boldenone will both increase hematocrit, red blood cell production, oxygen delivery to skeletal muscle, but they also increase oxygen demand by increasing your body weight. And as a net result outcome of that, even a hormone replacement therapy dose with a slight amount of boldenone and turinabol on top might already hinder your endurance and stamina, while in the, let's say, 1, 2, 3 rounds initially, your strength and aggression is certainly increased. So if you can knock your opponent out within the first 2 rounds, great, go with steroids. But if you expect to go multiple rounds, then I would suggest you to limit the anabolic androgenic steroids and look into performance-enhancing drugs that optimize endurance and stamina a little bit later in this video. There's a sweet spot range for most fighters where they get all of the benefits but none of the stamina-hindering side effects. As a general rule of thumb, your weekly anabolic androgenic steroid intake is going to be very similar to your body weight in pounds. If you're a 160-pound fighter, that means that you get to use 160 milligrams anabolic androgenic steroids over the week, with a maximum increase beyond that of 50%. So that will be a range between 160 milligrams to 240 milligrams weekly. So for example, if you're 160 pounds, that would be 105 milligrams testosterone enanthate, 105 milligrams boldenone undesonate, and then 5 milligrams turinabol weekly, which is already creeping up towards the maximum of the tolerable anabolic androgenic steroids that you could take without hindering your endurance and stamina. And again, you can always increase these dosages if needed a little bit later on if you get more experience. But if your starting dosages are too high, then your body weight will shoot up and you will probably gas out very early in the match, especially if you get into a chokehold. Then you only have a couple seconds to get out of that chokehold or tap out before you pass out. Improving endurance and stamina is way more important than your overall steroid cocktail, and it's reasonably straightforward. Whatever you can do to improve oxygen delivery and utilization and the removal of metabolic waste products will allow you to breeze through your workouts and matches, punches excluded. I've included all of the micronutrients which contribute to hematocrit, red blood cell production, and the oxygen carrying capacity of the hemoglobin contained within the red blood cells. Because, well, a lot of MMA fighters, in an attempt to keep their body weight levels down, have horrible diets, right? And since you guys don't really focus on recovery, but just train, red blood cell count is usually subpar, hindering your endurance and stamina. So please, for the life of you, supplement with a little bit of B9, B12, vitamin C, iron, copper, and to enhance the oxygen carrying capacity of the hemoglobin, to increase the affinity of oxygen to the hemoglobin molecules within the red blood cells, you can look into myo-inositol tripyrophosphate. It has a loading phase between 100 milligrams to 250 milligrams orally, 1 to 2 times daily. And then, so that will be 100 to 500 milligrams total daily, depending on how much hemoglobin you have and your overall red blood cell count, right? Do some blood work to assess where you are at baseline. And then a maintenance phase of 100 milligrams orally, Monday, Wednesday, Friday. Once the nootropic and endurance benefits are noticeable. You can look into salbutamol, preferably as an inhaler, to open up the bronchioles, allowing more oxygen in. And then you can use nasal strips, which is very easy. Just put it on your nose to allow for more oxygen and the perception of oxygenation into your lungs. I think this track is already very beneficial to improve the oxygen carrying capacity and your overall endurance and stamina. But if you need more, if you're not getting enough red blood cell count and hematocrit from the testosterone, boldenone, and this protocol of myo-inositol tripyrophosphate, then you can always look into erythropoietin peptides, whether that's erythropoietin bioidentical EPO or methoxy polyethylene glycol ipopoietin beta or darpropoietin alpha. That's entirely up to you, but only, really guys, I can't emphasize this enough, only after thorough cardiac and clotting factor screening. So get an MRI done or a CT angiogram done, check all of your clotting factors with blood work. Just make sure that there's no plaque buildup and issues with clotting because, well, if you increase your hematocrit to, well beyond superphysiological levels, then you increase the risk for blood clots and death. Right? So I can't emphasize this enough. The medical dosages are on the screen. This is a consideration point. If you don't have access to frequent blood work, stay away from erythropoietic peptides. And then to enhance endurance and stamina even further, you can look into metabolic modulation and mitochondrial function optimization. Your best option is probably methylene blue. It seems to be readily available and quite popular nowadays. I wonder why. Between 5 to 10 milligrams orally or sublingually, 30 minutes to 60 minutes pre-sparring sessions. And then before the match, you can mega dose it between 25 milligrams to 100 milligrams orally or sublingually as well. But don't overdo the methylene blue because it is known to reduce red blood cell count and hematocrit quite dramatically with longer use, especially at higher dosages. So I would go with a very low dose, 5 milligrams first, run that for 3 months before every session and maybe even on your rest days to see if it has a dramatic effect on your complete blood count parameters, right? This is why it's important to keep doing your blood work if you're a fighter. Look at Modulation to inhibit carnitine synthesis and shift fatty acid oxidation to glucose oxidation for energy production. That could be between 250 milligrams to 1,000 milligrams orally, 30 to 60 minutes before sparring sessions and before the match as well. You can split up the dose on rest days. Now, I would limit Modulation supplementation to 21 days consecutively with an equal amount of days off to restore carnitine synthesis and fatty acid oxidation. Otherwise, fatty acids will just accumulate, reducing insulin sensitivity. It might be best to reduce a dietary fat intake for the time that you're using Modulation, because again, if saturated fats start to accumulate in the skeletal muscle, then it lowers insulin sensitivity, and then it's more difficult to uptake the glucose that you're trying to burn with the use of Modulation. So dietary adjustments need to take place. And then alongside Modulation is diisopropylamine amino dichloroacetate, DADA, 25 milligrams to 100 milligrams intramuscularly, 30 to 60 minutes pre-sparring sessions or pre-match, but only 1 time to 3 times weekly, because this is potent stuff. WADA is a pyruvate dehydrogenase kinase 4 inhibitor, which promotes glucose oxidation for ATP adenosine triphosphate synthesis, but it also contributes to ATP recycling, dramatically increasing intercellular within skeletal muscle ATP content, basically giving you unlimited energy when combined with mildronate and a high carbohydrate diet. Now, keep in mind that increasing intercellular ATP content also has vasodilating effects, so you can't overdo it because otherwise your blood pressure will drop too low, which might be increased by using testosterone, boldenone, or other erythropoietic compounds known to increase blood volume. Right, so you might send some mixed signals. Increasing blood pressure, reducing blood pressure is very important for you to keep track of your blood pressure alongside the changes in blood work parameters while using these kinds of drugs. So let's say you go with 3 weeks of mildronate and diisopropylamine dichloroacetate, and then you want to take 3 weeks off. You could switch to a combination of cardarine with carnitine and icar. Cardarine improves fatty acid oxidation. You need to supplement carnitine, preferably injectable, alongside cardarine because it increases carnitine requirement. So that will be 10 to 30 milligrams oral cardarine, 30 to 60 minutes pre-sparring or pre-match. But I would limit it to 10 milligrams because higher dosages are known to be carcinogenic. Injectable carnitine can be 500 milligrams intramuscularly or subcutaneously 30 to 60 minutes before sparring. But if you get terrible post-injection pain, then I would just use the injectable L-carnitine all the way up to the match. And then on the day of the match, you could do, or leading up to the match the next couple of days, oral L-carnitine L-tartrate, let's say 500 milligrams with meals, between 2 grams to 3 grams total daily. Then you combine this stack with icar, 25 milligrams to 100 milligrams sub-Q, 30 to 60 minutes before sparring sessions and before the match, even though you might get some post-injection pain as well. But the icar post-injection pain will be worth it. Or you could do it IV directly before the sparring match, but you might walk out into the ring with a lump and a bump right here. So find another IV spot to administer this icar in. icar stimulates the activity of adenosine monophosphate activated protein kinase, AMPK, which is an enzyme that regulates cellular energy metabolism. This increases glucose uptake and improves insulin sensitivity, enhances fatty acid beta oxidation, especially in combination with cardarine and carnitine, and it stimulates mitochondrial biogenesis and promotes angiogenesis, which is a formation of new blood vessels. So you're going to have to choose between a combination of mildronate and WADA or cardarine, carnitine, and icar, which you can alternate 21 days on and off, depending on which one you prefer first and second. I prefer cardarine, carnitine, and icar, but again, there's something to say for both of them. Experiment. I would say start low though, start low and build your way up depending on how your stamina and endurance improves. And that brings us to improving hand-eye coordination and reducing reaction time. If you go online, you will find a boatload of supplements aimed towards gamers, touted to improve reaction time and hand-eye coordination, which is basically moving the mouse across the screen. Most of them are stimulatory based. Many of them are nootropics without, from my practical experience, having coached a good amount of MMA athletes through their sparring matches and actual matches. Most of them don't work. So I would limit yourself to caffeine, alpha-GPC, uridine 5-monophosphate, Nupept, and amoxapine, where Nupept and amoxapine are going to offer the most pronounced effects regarding hand-eye coordination and reducing reaction time. Nupept can be 10 milligrams, maybe 20 milligrams if you prefer, but usually 10 milligrams is more than enough. 30 to 60 minutes before sparring sessions or matches. And then with amoxapine, it can be between 125 milligrams to 250 milligrams, either 1 times to 3 times daily, which is a bit of a range, but everybody responds differently. One of those servings of 125 to 250 milligrams should be 30 to 60 minutes before sparring sessions or matches. Give a low dose a try, especially if you use methylene blue. That's a bit of a potent combination for overall nootropic effects and to improve hand-eye coordination and overall energy levels. They have a good amount of synergy. And then again, you can always ramp up the dosages if needed. The main reason why I only included these is because they are not known to increase blood pressure. And with increased blood pressure, vasoconstriction, the oxygen delivery through red blood cells is severely diminished. So if you go with something like a low-dose Adderall or low-dose modafinil or low-dose Ritalin or even paracetam to improve reaction time and hand-eye coordination, vasoconstriction will hinder your endurance and stamina. In my opinion, if you stick with caffeine, alpha-GPC, uridine 5-monophosphate, Noopept, and amoxapine at low and effective dosages, your hand-eye coordination will severely improve and your reaction time will significantly decrease, especially when combined with methylene blue. And that brings us to post-match recovery of traumatic brain injuries. Ideally, to get you out of this fight or flight state directly after the match, so as soon as you're either dragged off or you're walking out of the octagon ring, look into a beta blocker like propranolol, for example. For acute recovery, immediate release propranolol would be anywhere between, depending on your tolerance, 10 milligrams to 160 milligrams directly after the match. And then you can go with a maintenance dose for a couple days after the match to kind of lower your sympathetic drive and allow you to recover and rest and digest. Do the tour of post-match interviews, not Valium, not alcohol. That will hinder your recovery even more, while beta blockers will actually improve your recovery. So you go with an extended release propranolol, 40 to 160 milligrams before bed, or a nebivolol between 2.5 to 10 milligrams upon waking daily, right? For the days that you need to recover from this match. Don't increase nebivolol beyond 10 milligrams daily, because then the selectivity for the beta-1 adrenergic receptors is lost, and it also starts blocking the beta-2 adrenergic receptors, maybe making you fat, which is a common occurrence post-match, especially when you had to undergo a weight cut where you severely restricted your calories. If you start blocking the beta-2 receptors and you start eating your victory dinners upon dinners upon dinners, then you will probably get fat, and then the next weight cut is going to be significantly more difficult. So a little bit caution is advised here. And then the Rolls Royce of neurogenesis, cerebrolysin, derived from pig brains containing multitude of different neurotropic factors. I have dedicated videos on this subject. They're linked down below. For acute recovery directly after the match, 50 milliliters intravenously. And then for a couple days, between 10 to 30 days, depending on how traumatic the brain injury is, whether you won or lost, right? How many punches did you get to the face and how hard were you choked out? 20 to 50 milliliters, either intravenously or intramuscularly. On the lower end, you could do intramuscularly. 20 milliliters intramuscularly is already a lot. And if you go with 50 milliliters daily for 30 days, go with intravenous administration. And as a maintenance dose, between 5 to 10 milliliters intramuscularly before bed. You can do this as soon as you start preparing for the next match. But I will say that with chronic and frequent and prolonged and high-dose cerebrolysin administrations, it will reduce your aggression and make you mellow, because the neurogenesis will take all aggression away over time. So don't overdo it, right? You need this aggression for the next match. Obviously, you can stimulate the aggression again with halotestin or a couple slaps in the face before you walk out into the ring. But with prolonged use of cerebrolysin, what I noticed for myself and a lot of bodybuilders and even MMA fighters, they say that the aggression is lost. So again, if you have traumatic brain injuries and you need to recover brain function, high dosages go a very long way to improve brain function in a reasonably short period of time, but don't use it too long, because otherwise your next match, you'll be a pushover. Following the match, you might use non-steroidal anti-inflammatory drugs to kind of lower the inflammation on the body parts that were hit, right? It's highly case-by-case dependent, but I think this is the gist of how to use performance-enhancing drugs before, during, and after matches. If you feel I left something out, you have a lot of experience coaching MMA athletes, or you're an MMA athlete yourself, let me know down below which drugs you prefer, and if you would like me to make a WADA or USADA compliant MMA stack where you can 100% guaranteed beat the drug test, because none of the compounds that I'll discuss will be included in the WADA prohibited list of 2024. Thank you guys so much for watching. You can find everything that I'm associated with down below in the YouTube description section. Follow me on Instagram and TikTok at VigorSteve. Vigorous crew, you guys know what to do. An anabolic frontal bicep for you guys. That's a lot bigger than last week. And stay tuned. I'm on a little bit more than cookie cutter hormone replacement therapy, but hey, I'm not a fighter. I'm a lover, baby. And I do love pretty hard. Thank you guys so much for watching, and I'll see you in the next video.